Good evening, and welcome to the Colon Cancer Alliance's final webinar for 2016, Managing the Financial Burden of Cancer. My name is Kevin Bergerson, and I'm the Program Manager with the Colon Cancer Alliance, and I will be your host this evening. The majority of calls to our 877-422-2030 Colon Cancer Alliance Helpline has to do with money. The good news is that there is hope and there is help, but it starts with being proactive. This evening, we will help you discover ways to help alleviate the financial burden of a cancer diagnosis by combining national and community resources, as well as how understanding the basics of insurance can help you. As a reminder, this webinar is being recorded, and all registrants will receive a link to where we have posted the webinar recording. Before we get started, I'd like to remind everyone that neither the Colon Cancer Alliance nor our presenters are going to be giving medical advice, and no doctor-patient relationship is intended or established. You should always seek in-person medical advice and make medical decisions together with your individual clinician team. It is my pleasure at this time to introduce our expert speakers this evening, Carol Orr and Crawford Clay. Carol and Crawford are two of the Colon Cancer Alliance's 7 certified patient and family support navigators. Since graduating from Springfield College with a degree in rehabilitation services and psychology, Carol has always worked in the healthcare field. Having been a caregiver to a family member going through cancer treatment, she understands the time and compassion involved, but it was her role as an oncology social worker at the local community hospital that really opened her eyes to the crippling costs of cancer battles and what that effect has on the entire family. With the majority of her workday spent finding ways to help patients afford treatment and keep the households afloat, Carol says the trick to navigating the financial waters of a cancer diagnosis is to combine the help from national foundations as well as community resources. After 7 years as an oncology social worker and 4 years as a patient and family support navigator with the Colon Cancer Alliance, Carol's goal is to share some creative ways to tap resources to help relieve the financial stress of cancer so patients can focus on the fight for their life. Crawford Clay's father and grandfather had colon cancer, and Crawford himself is an 11-year stage 3 rectal cancer survivor, so this disease is very personal to him. Crawford serves on the Colon Cancer Alliance's helpline and chat rooms and serves as the head of patient quality of life, advocacy, and insurance issues for the Colon Cancer Alliance. In his spare time, Crawford enjoys spending his afternoons throwing balls to his chocolate labs. And with that, I'm going to turn the webinar over to Carol here. Welcome, Carol and Crawford. It's a tremendous pleasure to have you here this evening. And with that, take it away, Carol.
All right, well, thank you, Kevin, and thank you, everyone, for joining us tonight. I realize I don't have to tell you how concerning it can be to manage your finances while you're fighting a serious illness. You already have enough to focus on, and most of you may have been unable to keep working while you're in treatment. Yet both those medical expenses and the household expenses continue. My goal tonight is to kind of give you a little bit different take on managing the financial burden. I'm hoping to share some ideas that on where to find assistance that you may not have really thought about previously, kind of creative possibilities that I've learned over the past 11 years of helping cancer patients, and I hope they're going to make a difference for you. So I'm going to start with the basics here. We kind of have to go through the groundwork here before we can get to the really good stuff. But there's 3 key points that I hope you will walk away with tonight, and that is to talk to your insurance company and your healthcare team, take control of your household expenses, and combine the national and community resources to your best advantage. And we'll start with the basics here, that you need to make a phone call to that insurance company or your human resource representative at work, understand what the insurance is going to cover, understand what your out-of-pocket expenses are, the deductibles, the co-pays, the co-insurance, and even know about travel expenses too if you're going to have to go any kind of distance. when you're talking with the healthcare team, you want to be upfront with them and let them know what you've just found out from the insurance company. If the co-pays are going to be tough for you, you need to let the healthcare team know that. If maybe the copay for an office visit is going to keep you from coming in for your appointments and treatments, you need to say that to your healthcare team. If it's going to keep you the cost of prescriptions, may keep you from being compliant with the drugs, they need to know that too. You can also check in with the social worker, the patient financial navigator. If the doctor doesn't suggest that, then ask to make an appointment with them. There are payment plans. You can talk to the billing office at the treatment facility to see what kind of payment plans are available. If for the prescriptions, there are numerous patient assistance programs for copay assist on those, and the social worker can help you apply for those. The social worker is really going to be one of your biggest allies, so I really encourage you to try and get in touch and establish with the social worker in that office. If you don't have insurance, then you need to look into the state and federal programs. Again, the social worker can help you with those, but that is an option for you. And Crawford is going to take it from here and talk to you about those for a little bit.
Okay, thanks, Carol. If you can click over to our first slide here. I want to talk to you guys for a few minutes. First off, welcome everybody. I want to talk to you for a few minutes about insurance. You hit the slide there, Carol. Insurance is something you don't really think about until you need it, and then that's all you think about. People who have chronic diseases like cancer end up with degrees in insurance for sure. And today we're going to do a quick overview of Insurance 101. So let's talk cost control first. Let's say two quick words about people on Medicare. If you hit the slide, Carol. Supplemental insurance. Do you need it? Yes, you do. It's going to help control your cost. Supplemental insurance is why my 88-year-old dad is still alive. We couldn't have afforded his medicine for the last 10 years if it weren't for the supplemental insurance. Like Carol said, premiums are important. They're the things you can budget for. You know how much you're going to pay. Deductibles and copays are surprises. They're harder to budget for because you don't necessarily know what they're going to be each month. What you want to do when you're making your insurance plans is avoid situations where you can't afford a treatment for yourself or a loved one. I've been there. It's awful. Done that. Don't want to do it again. If you end up with a situation where you can't afford your treatment, though, there are things you can do. Slide, please, Carol. You want to shop around. You'd be surprised how much prices can vary from place to place within a metro area. I've seen colonoscopies vary from a low of $1,000 to a high of $8,000. I don't think one is 8 times better or 8 times more fun than the other. Same thing, hospital is always more expensive than your doctor's office or private outpatient clinic. You want to make sure everyone's in network. You want to negotiate. That's the price they quote is kind of like a sticker price in the car. They're not really expecting you to pay that out of pocket for any big ticket items anyway. You can do a payment plan. I've done that before. Getting paid over time beats not getting paid at all, for sure. Talk to your hospital about charity care. That's a government program that most public and private hospitals have. And you can find more about that on our website and on our blogs. And of course, you can always call us with questions, 877-422-2030. Slide, please, Carol. So you've done all these things, and you get your bill, and there's a surprise on it. You've had a claim denied or something's gone wrong. Well, what do? Well, first off, you don't roll over. You're going to stand up and do something. You're going to, first off, look at your explanation of benefits. Slide, please, Carol. Check the facts. Is that your doctor's office or hospital you're treated at? Did they spell your name right? Clay Crawford's claim is being denied on Crawford Clay's insurance. Is that your insurance policy number? It's very easy to get those messed up. And is that your treatment? This is true. I wanted to have my rectal tumor removed. Nurse walks in and looks at me and goes, You're not here to get a fibroid removed, are you? It's kind of a big oops moment, but it happens more often than we think. That slide. After you check the facts, check your math. Did they get the numbers added up right? If everyone was in network, make sure you get charged network prices. Make sure the numbers add up. Often they don't, or there's an extra zero thrown in there somewhere. Double charging and mischarging is surprisingly common. Most experts will tell you that the majority of insurance bills have some sort of error on them. So what do you do when you find one? Well, first off, you don't need to go nuclear first. It's probably an honest mistake. Just call your doctor's office or your hospital and see if they can't straighten it out for you. If they can't, talk to your insurance company. If that doesn't work, then you escalate. The first place I would go is my HR rep at the office if I have insurance through my employer. See what they can do. You can talk to your state insurance commission or commissioner. You can find them on Google pretty easily. If you have insurance through Medicare or the Affordable Care Act, your congressperson is a great resource. You can find them at www.house.gov. And they've got a 20-year-old on staff whose job it is to read your email and answer it and make sure you're happy. So you can always go to them. You can talk to a consumer reporter at your local news or a national one like Clark Howard. You stop and think about it. You're a cancer patient. You just got denied coverage, or you just got denied treatment you needed. That's a story, and they're going to be interested in picking that up. If that didn't work, slide please, Carol. Now it's time to go nuclear. Slide. We're talking social media. Public shaming is a powerful force in America. Don't believe me? Think about the people who made the EpiPen. They've had a horrible, miserable 6 months. Slide, please. Most companies in America have a Facebook page. Their consumer complaint departments run Facebook or Twitter, and the CEOs as well. And I just, over the weekend, had some problems flying home, and I was on Twitter tweeting about it, and within 15 minutes I had a reply. So you have 140 characters to make your point, and people will get back to you pretty quickly. And finally, if you've got the skills, YouTube is for you. If you can do drama, if you can do music, that can really make a difference. Sometime when you're bored, go on YouTube, look up United Breaks Guitars. This guy had a band, they broke his guitar, United refused to pay for it. He made what's really a very good, very funny video, and now he flies for free on United and has a United guitar. So it does make a difference. So get out your laptop and go to work. Hopefully this will make them do the right thing. And of course, you can always call us, 877-422-2030, and we will do what we can as well. A slide, please, Carol. A few quick words about the Affordable Care Act. First, when can I sign up? Open enrollment starts November 1st and runs through December 15th. That's for insurance that starts on January 1st. You can actually enroll all the way through January 31st without running into any problems. After that, you have to have a special qualifying life event. That's something like a change in insurance or employment, a move, getting married, that kind of thing. Remember, you have to sign up every year, just like you do with regular insurance. What does it cover? Well, first off, as I think hopefully we all know, you have to cover pre-existing conditions now. It also covers preventative screening tests. You can go to our website and look up and see what tests your insurance covers in your state, because not every insurance policy covers every screening test. And a quick aside, if you're like me and have a history of colon cancer, you're not getting a screening test, you're getting a diagnostic test, and there's going to be a copay or deductible involved in almost all of those. It also covers prescriptions and treatment at some level. There will be a copay or cost share or some sort of deductible involved. If you know that you need a specific treatment or are going to be taking a specific prescription, when you're buying your insurance, do some research and make sure they cover it and make sure you know what your out-of-pocket will be. That can really save you some money. Slide, please, Carol. So you want to do some research before you buy. Here are some helpful websites. Kaiser Family Foundation has good, up-to-date, accurate insurance information. It's kff.org. It does get kind of nerdy at times, but on the other hand, they do have cartoons as well, so it balances out. NPAF can help, npaf.org. They help with insurance and Medicare issues. The Colon Cancer Alliance website is actually a pretty good resource, ccalliance.org. I've done blogs on charity care, insurance disputes, and other things. You can go to the website, look in the search bar, type in charity care or insurance, or if you can't think of that, just type in my name, Crawford Clay, and you'll get up a bunch of blogs. Finally, healthcare.gov is where you go to sign up for and learn more about insurance through the exchanges. So slide. Just want to give a quick thank you, and we'll be taking questions at the end. So back to you, Carol.
Okay, thank you, Crawford. And you'll see listed here some of the different organizations that can help with prescriptions. Nearly every pharmaceutical company has their own patient assistance program for assistance. There are some foundations out there that will do the work for you and check different options. And Cora Cancer Foundation is a new charity just recently established. It does help with copay grants for chemotherapy and targeted therapy drugs. They even help with travel assistance. They not only have financial assistance themselves, but they do have financial education in the form of a booklet that has 10 great tips. It's all written by an attorney. It's very helpful. I encourage you to look at their website in coracancer.org and to use that information. Needy Meds is another great organization. You can just type in the name of the drug you're looking for, find help for that. If there is a PAP program available, they'll have the application there. They have drug coupons. They have a drug discount card that is honored across the country. Rx.com is a website where you just simply put in the drug you're looking for and your zip code, and they will compare the prices from the different pharmacies in your area to see where you can get the best cost. Partnership for Prescription Assistance is another one along the same lines, and they will do the work for you to match you up with those different programs. All those programs are funded by private donors and the drug companies themselves in most cases. And then as far as these specific drugs that are, as you all know, a little more costly, every pharmaceutical company does have a program to help pay for those. Amgen with Neulasta, Bayer with Stivarga, Genentech has Avastin and Xeloda, Sanofi Aventis with Lovenox and Zaltrap, Taiho Oncology with Lonsurf. I know a lot of folks are on Xeloda or have that as a prescription to take Xeloda or capecitabine. We get a lot of calls about that one. It's very difficult to find copay assist for that drug right now, but with a couple of those foundations that I just mentioned on the other slide, including Ancora, they will help with that drug. The other option is to talk to your MD, your doctor, about the possibility of getting the 5-FU infusion. Most insurance companies will pay for the infusion form of Xeloda, but will not pay for the pills, or you may have too large of a copay with your prescription plan to use those pills. So just talk with the doctor. If the Xeloda is not feasible, although it's inconvenient, see if you can do the infusion form of that one. Don't give up. You got to keep working it. A lot of these organizations, they have the funding in the beginning of the year, and it is exhausted within a few months. I know it's tough to keep track of those, so you want to keep a notebook handy and write down who you talk to and when. Keep calling them back. Be persistent with it. There's one family that I helped with a few years ago, and it took them 23 phone calls to finally get within the program. And but when they did, they had free drug for a year. So it's worth it to be persistent, to find out, you know, when they have funding. You never know when a donor is going to make a large donation and now they have more money to share. So keep track of who you're talking to and keep calling them. Be creative with this too. If the organization doesn't specifically list that they have funding available for colorectal cancer, see if they have it under another condition that you might be experiencing, such as the Caring Voice Coalition does not support a diagnosis of colorectal cancer, but they do support a diagnosis of chronic pain. So if a fund has exhausted all their resources for colorectal cancer, maybe you can get at least a couple of your medications paid for under a different condition, not the diagnosis, but the chronic pain. Patient Services does the same thing. They support a diagnosis, or well, I should say a condition there too, of the malignant ascites. They also have a program for breakthrough cancer pain. They do not support colorectal cancer, but they will support these two things, and you might be able to find some assistance that way. Mental health, it's mind, body, soul, it's free. There is free help available. We all need help from time to time, both survivors and caregivers. Some insurance companies will cover professional counseling services. You need to check with your insurance company to make sure you stay in network. Your social worker, once again, if they are an LSW or MSW, they are completely capable of providing counseling services for you. Make an appointment. It's free. It's part of the team approach at your facility. Cancer Care has licensed social workers available on the phone. They will allow up to 5 free counseling conversations, and after that they will help you find a counselor within your town. Catholic Charities is another group that does have professional counseling available. Theirs is based on a sliding fee. And the Colon Cancer Alliance, if you are looking for support but not the professional counseling services, but rather a terrific support program, we do have our buddy program for both survivors and caregivers. These are kind of mentor volunteers who can really relate to what you're going through because they've been there. We also have our online communities as well, and all of that can come right from home. Both of those are great support. Stuff happens, and now that you're covered, or at least have some ideas about your medical bills and things, what do you do about the kids? An ER visit can really break the bank, and as well as child care. The kids need their dental exams, eye exams. Make sure they're covered, and CHIP is a good way to do that. It is for uninsured kids and teens up to age 19 who are not eligible for medical assistance. It will cover all those routine doctor visits too, but without it, you're going to find some very expensive bills. So the second thing I mentioned that I wanted you to remember is to take control of your household expenses. Know where you stand. Don't let those bills pile up. Let the creditors know your situation as soon as possible, and take advantage of hardship programs. There are a lot of those out there. You want to see what it takes to get enrolled with those programs. And I really encourage you to talk to a budget counselor as well. A lot of agencies have this service at no cost. It's worth talking with someone that can help you out. A couple little things to try as far as helping at home is, can you lower the cable bill? Some cable bills are really quite expensive, and I realize that after, on your off week or even following your chemo, you're going to want to rest and maybe just watch a movie, whatever, but do you really need 300 channels to choose from? If you can lower that bill, that's going to help. Do you have both a landline and a cell phone at home? Maybe you can drop one. SafeLink provides free phones for folks. If you qualify for those, it's worth a phone call to 1-800-SAFELINK. Can you make do with one car? That's another possibility. It's half the insurance, half the upkeep. If you can get by with one car, it will save you a lot of money. The possibility of obtaining a loan on your life insurance policy. American Life Fund, Fifth Season Financial, You'll see those in our resource guide. It's possible to get a loan based on that policy, and every little bit is going to help. You can try, when you're at the grocery store, you can save a little money by buying the store brand versus the name brand. It's a little thing to do, but normally those are made in the same factory. They just have a different label, and they can charge more for the brand name. So pick the store brand over the grocery store. You can shop at consignment shops. We get a lot of calls from folks saying that I've dropped a lot of weight, I need all new clothes. Consignment shops are a good place to look. It's just gently used clothing, and it's not going to cost very much. Take advantage of specials at restaurants, half-price meals, early bird specials, and we've got a lot more creative ideas coming up too. Make those calls to the bank, the mortgage company, the landlord, the phone company, the electric company, the water company, even the trash collectors. Ask for payment plans. Get the doctor to write a letter as soon as you can, verifying that you have an illness, and ask the utility company for the hardship applications. The Public Utility Commission has various programs. They differ from state to state, but you can call. Usually, if you have the doctor write a letter, you can get an extension on your bill for 90 days. Some states, as long as 120 days. That they will not shut off your utility if the reason you're not paying it is due to an illness. That also varies from state to state, but certainly worth looking into. And if you have any problem with that, contact your local legal aid office. That is free legal help. They will jump in and help you with those kinds of things. So it's combining the national and community resources that I think is really going to be of most advantage to everybody. Creativity counts for this. You can find a lot of these resources, in fact hundreds, on the Colon Cancer Alliance Support and Financial Resource Guide. It's on our website. It's a living document that is constantly updated. Every time we learn of new organizations, they are added. Our list does have both community resources and national resources. That Angora list that I had mentioned earlier, they have a lot of national resources. I would use both of those. And again, ask the social worker to jump in and help you. They're going to know of the different local resources, and they can help with the applications too. That's a picture of our financial resource guide. Again, you can download that right off our website. We do have it all categorized that you can even look under, say, young adult programs for those who are under 40. There are programs just for seniors, prescription assistance, travel, free publications. It's a very helpful guide. Again, I encourage you to keep that notebook of who and when you talk to. Apply for anything and everything that makes sense to you. And always ask if one group knows of another. There may be kind of a sister organization in a different town, and maybe one group isn't going to serve your county, but another one will. So always ask if they know of another group, and be creative. Think outside the box. Churches are an excellent resource for help. You can talk to the pastor about financial assistance. Put an ad in the church bulletin. You can find help with transportation, with meals, ask for babysitting help, cleaning, even just companionship. The churches usually have members that are very willing to help. They just need to know who to help. Christian ministries offer financial assistance. A lot of times they are local to the town. I know the one that is near me, Hope Christian Ministries. They will help people with things like rent and utility bills. They will help with 1 month if you can tell them how you're going to cover the next month. And that'll get you through a crisis right there. Different social service clubs, you may not have thought of these, like the JCs, the Lions Club, the Elks Club. All of these clubs provide something different and unique. The Lions Club, for instance, has eyeglasses and hearing aids available. Most of them do get donations of hospital beds, recliners, wheelchairs. Just ask them, ask what they have. The VFW Club does have a stipend available for veterans, and that's worth applying for as well. Other resources, if you call the United Way at 211, they can provide you a listing of what is available in your area. They can even give you a listing of food banks, or you can log on to Feeding America and find out, where there is a food bank in your area. The United Way does know of the food distributions from the Department of Agriculture. They can tell you when and where those will be, and they do provide you with several boxes of food at a time. Private local foundations are going to help with financial assistance too. Again, your social worker, as well as the United Way, is going to know about those. It's worth the phone call. If you're over 60, definitely tap on your local Office of Aging. Some places call it Department of Aging, it may be the Area Agency on Aging, but they're definitely a great resource for folks 60 and over. They can help with Meals on Wheels. Sometimes they have utility discount programs. They can help with transportation to medical appointments, reimbursement on supplies used at home. They have a great homemaker program, and those services are based on a sliding scale, which is a lot less expensive than going through private duty. They know about tax credits. And they even have a program called a prize, which can help you sit down and figure out what is your best insurance option. Crawford mentioned how supplemental insurance are two key words. The prize program will help you make the best choice for you. And this is where I'm hoping that I can really enlighten you with some great ideas here. Do you live near a college? If you do and there's a dental school, tap on the dental school to get your teeth cleaned, for any kind of dental needs for your family. They're not entirely rookies. They are people that have some experience under their belt, and it would be significantly less expensive this way. You can also get tutors for your kids at the local colleges. Tap on the other schools too, the trade schools such as the beauty schools. I know a couple of the ones around here, they do offer haircuts for $5. The Votech School is another great resource. Depending on what the kids are studying, you can get things like car repairs. I did set up a situation where the person needed their car to get back and forth to treatment, but they had some significant and expensive issues with it. The Votech School made those repairs, just charged them for the parts, but not the labor. And so it worked for the kids at the school who were under the guidance of their instructor, but it also saved a lot of money. The other thing, too, you can think about is, when you have the other household expenses of like birthday parties and holidays and graduation parties, any of those types of things, you can tap on perhaps their culinary arts school and get cakes and desserts and things made at a very low cost. Senior service hours, this is a great resource if you have, if your local high school does require that the seniors have to log in. Usually it's about 40 service hours in order to graduate. Contact the guidance counselor. You can find kids that are very willing to cut the grass, shovel the snow, walk the dog. I have in the past set up that folks could give the kids a grocery list. The kids would take the list and get everything, bring it back and put it away for the patients, and that worked out great. Just contact the guidance counselor there to see what the guidelines are and who is available. And do take advantage of offers from families, the family, friends, and neighbors. People do want to help you. It's a win-win. They want to help you. They may not quite be sure what to do to help, but if you can be specific about what to do, maybe, can you pick my son up at soccer practice? Can you stop by the drugstore for my prescription? Anything, any kind of errands, or make a meal for us tonight. Just be specific. You get your need met, and those folks do feel like they're helping you some way. It's definitely a win-win. So the holidays are approaching. In fact, we're only 37 days away from Christmas. Maybe you need some help with the Christmas gifts for the family. The Toys for Tots, you can apply online for that. The Salvation Army has their Red Kettle program. You can sign up to get packages that way. Churches are a good resource. Once again, they normally have an angel tree. Ask to have your name added to that so that you can have some folks taking care of gifting for the holidays. The holiday bazaars that the churches hold, you can go there, get low-cost gifts, usually handmade. You can get food. They usually have the white elephant table where you can find all kinds of kind of flea market items in good shape. That will save some money. Check out your local hospital to see if they have an Operation Santa type program going on that you can turn your name in, and usually that has to be on the recommendation of a social worker. So again, tap on that social worker, see if you can get your name in there. They will provide gifts for the family. You just provide a list for them. They will do all the shopping. The Dream Foundation actually has a toy foundation for the holidays. You can see that one there, dreamfoundation.org. And again, the Lions Club. Usually you just have to ask for what you need and see what they can provide for you based on that. But they will help out with the with gifting. And one more thing I wanted to tap on is we all could use a respite, and the Dream Foundation does have a program where you can take family vacations. The doctor, of course, has to make sure that medically you can leave their care to take this break, but as long as you have the doctor verifying that, they will set up this trip for you. Memories of Love is specifically if you have children under the age of 16. For Pete's Sake is another one. Sometimes where they send you on a trip is based on folks donating their vacation homes for a week or so at a time. And most of these organizations will also provide some spending money on that trip. There are many more of these. One caveat, you've got to make sure they have been rated by Charity Navigator. And ask what else they offer. Sometimes it's not only the trip, but it can also be maybe they will pay off a bill for you. And Dream Foundation has even mentioned that they bought dentures for somebody. Just ask, and that's pretty much throughout all of this is to just ask people and find out what is available out there. It doesn't hurt. The worst they can say is no, but you can get help. And I'm sure we can come up with a lot more ideas. The idea here, though, is to just mesh all these different resources and take to your best advantage. Take advantage of all that do seem to apply to you and keep applying. And I hope that these little tips and ideas have, kind of been empowering to you, and you can walk away with a few new ideas. And thank you. I think Kevin will take some questions.
You bet. Well, thank you so much, Carol and Crawford. We got some time here for some questions here. Real quick, if you wish to ask a question, we're going to take those written questions interactively via the GoToWebinar software. To ask a question, click on the small plus sign located next to the word questions on the right side of your screen. Type your question in and hit enter. If we are unable to answer your question tonight, we will get back to you by email. I'd like to add on something here real quick to what Crawford said about being persistent if you're in a insurance type situation and it's going south on you, it's not turning out the way you want. He mentioned going nuclear with social media. I do know that there in one very famous case in Arizona, there was an ASU grad student who was a stage 4, had insurance through a major health insurance company that I won't mention, which dropped him after a year of $11,000 per treatment, and they dropped his coverage. Well, the patient, engaged in a Twitter war and rapidly got public opinion way on his side, and ultimately resulted in the insurance company changing their tune and engaging and allowing him to finish his treatment. Crawford, real quick here, can you touch on the program that we have, our Blue Hope Prevention Fund that folks can apply for? That is another resource that we'd like to have folks get to be aware of.
Oh, sure. That's a good point, Kevin. The Colon Cancer Alliance, of course, is very interested in getting everybody screened. So we've got a couple of programs that are worth mentioning. We've got a partnership with Colonoscopy Assist to help uninsured people get screened. So you would need to call us on the helpline 877-422-2030 and get signed up for that. If you have insurance but have some co-pays or difficulties involved, just go in to get a colonoscopy. You may need a babysitter, you may need transportation help, whatever. You can go to our website, ccalliance.org. Look under Get Support for financial information, and that'll take you to the application for financial help with screening. That's for insured people. And again, if you don't have insurance, you call the helpline, and we'll get you signed up for our partnership with Colonoscopy Assist.
Oh, Crawford, thank you. So can you talk a little bit about the Blue Hope $200 award that we have as well?
Sure. We have what we call our Blue Hope Award. And what that is, it's a one-time award of $200. We give out quarterly to people in active treatment for colon cancer. We define active treatment as being surgery, radiation, or chemotherapy anytime during that quarter. You apply online on our website, ccalliance.org. Again, look under Get Support for financial aid. They'll take you right to the application. It takes about 20 minutes to do. And you'll hear if we respond quarterly, you'll either get an email or a letter back at the end of the quarter letting you know what's going on.
Very good. We have a question here. Crawford or Carol, are you familiar with some of the insurance implications regarding compassionate use, named patient, extended access programs? Are you familiar with that particular program at all?
I'm somewhat familiar with expanded access. I'm assuming the question is how much will insurance pay for that, and that's going to really depend, I think, on your policy. That's something you'll want to talk to with them.
Okay.
Carol, do you have anything to add?
No, I'm sorry, I'm not as familiar with that.
Okay.
What kinds of advice would you offer to a colon cancer patient who has to deal with aggressive debt collectors? Because a lot of times the hospitals transfer medical debt to debt collectors, and that's kind of a thorny issue that a lot of people have to deal with. Do you got any counsel for them?
First, I would say take a deep breath and relax. They're going to put a whole lot of pressure on you, but they know better than you do that you can't get blood from a turnip, as they say. Medical debt is not inheritable, so it doesn't pass on to your kids. Try to work with them and work out a payment plan, but don't let them intimidate you. I guess what I'm trying to say.
Right, and the only thing I would add to that too is, again, talk to them about payment plans. As long as you are paying something on the bill, they're normally willing to work with you. It's when you totally ignore the bill, and I know that's easy to do, you just kind of throw it aside, but as long as you're making an effort, they will ease up on you. And again, just work with them on the payment plans.
All righty, and Carol, you mentioned earlier about some insurance coverage for the infusion form of Xeloda, but not the pill. Can you? Is there a difference from the insurance company's standpoint regarding that patient assist program?
Well, Xeloda is they no longer have a patient assistance program for Xeloda since with the generic form of that drug. So a lot of the insurance companies a lot of the people are left with quite a big copay for that particular drug, and we do get a lot of calls about that one. My point was to just say that if the copay for the pill form, if that is just not feasible and too expensive, tap on all those different organizations that I mentioned for assistance. If it's still out of the question for you, then I would talk to the doctor about using 5FU, which is the infusion form. It is metabolized a little bit differently, and the doctor can explain all that to you. I'm not a doctor, but and it's a little more inconvenient because of having to go to the infusion center, but oftentimes the insurance company will pay for infusions, whereas they may not cover the cost of the oral medication. So it's just another option.
And Kevin, let me jump in on that too. If you're on Medicare, the 5FU infusions cover under Part B. So if you somehow neglected to sign up for Medicare Part D, they'll cover it. And the other thing to remember about 5FU, I was on it when I was in chemo. My grandfather was on it when he was on chemo back in the 60s. It does the job, and it sells for about $6 a dose. Of course, there's other fees attached to it, but it is very cheap and affordable. So if Xeloda is out of your reach, don't be ashamed or embarrassed to go with the 5FU. It'll do the job.
Any recommendations on how to deal with an exceptionally large hospital bill, which resulted from, accumulation of deductibles and copays?
Yeah, go ahead, Carol, you go first.
Well, I was just going to speak to the point you brought up earlier, Crawford, about charity care. Most hospitals do have a patient assistance program where they have charity care that you can apply for, and it's always worth doing so. They're not always going to invite you to apply for that. You're going to have to ask for it to see if there is a program. But they will either put you on a payment plan to whittle down that bill. Sometimes they can actually forgive part of it, and they're not going to pay the entire thing in most cases, but it's always worth asking about. And Crawford, were you going to add to that too?
Yeah, I was going to go back to something you said earlier. What I would do is tomorrow morning when I get up, call the hospital social worker, ask her or him to help you with that bill. The sooner you get on it, the better. And there's people there at your hospital who can lead you through the process and help you find some sort of help.
Alrighty, our next question here. Let me find one. Here's one. Do you happen to know any international charities for colorectal cancer patients who live in other countries? Specifically, we have an individual who's logged on this evening from Mexico, and they're looking for some information. And if this is something that we could research after the fact, let us know, and we'll move on to another question. But are you aware of any international support?
I'm not off the top of my head, but that's exactly what I would suggest, Kevin. I'm happy to research that and see what I can come up with.
All right. Well, we will definitely get back with you, Fernando, on that regard. And
hey, Kevin, let me jump in real quick and say, look at the Global Colon Cancer Association. They don't have money, but they list most of the colon cancer groups in the world, and maybe there is one in Mexico you could contact.
Okay. And earlier on, you mentioned briefly that medical bills may be passed on to your survivors. Is that accurate, or can you talk about that a little bit, or and how do we avoid that?
What I meant to say was that they're not inheritable. That they are not passed on to your kids. So that huge bill we all rack up getting treated stays with you.
Very good. Very good. That's a good clarification to have. So
I'm glad you asked.
We have, unless any other questions do come in, we've handled just about all the questions that did arise. Is there any other things that you wish our attendees to know, Carol and Crawford?
I was just going to ask if anyone had kind of a scenario that maybe we could walk through with you to see the different resources to tap on. That might be helpful. I know a lot of people looking for things, specific to household expenses. There are different organizations out there, again, local, so you want to talk to either United Way or the social worker, but there are some local foundations. A lot of those will cover that type of expense versus prescription costs and copays. They will help with household expenses. And normally the social worker is going to know about that. They can help you with the application. I know of several cities, and we have them listed on our support and financial resource guide, but those are definitely worth tapping on. Those are the ones helping with rent are not going to be the national organizations, but more the community organizations.
Very good. And Crawford, any parting words before we close out this evening there?
One other thing I would encourage people to look at is if you're looking to apply for Social Security disability or you have any sort of employment issues, don't face that on your own because it's too complicated. We're partners with a group called ALSUP, ALLSUP, who specializes in that. And again, if you can't remember the name of that group, just give us a call and we'll help you guys get connected. But I guess my point is don't face any of these problems alone. Let someone help you.
Well, thank you, everyone, and for your questions, but we're just about out of time for this evening. And as a reminder, all of you will receive a follow-up email tomorrow with this link. This is our feedback survey link. We want to know how we're doing on this particular webinar so we can make them better. That same email will also have a link that will take you to the recording of this webinar so you can watch it at your leisure over and over again. So look for that email from me tomorrow. I'd appreciate your feedback. And also you can have a chance to review the webinar when on that particular email link when it gets to you. Before we go, if you have any questions or challenges or other treatment questions you may want to ask in a more personal one-on-one setting, you can speak directly with Carol or Crawford or other certified patient and family support navigators by calling our helpline at 877-422-2030. And you can also visit them online for live chats at ccalliance.org. Thank you all for attending. We hope you enjoyed this webinar, and we really hope that you found it informative and you got a couple extra tools in your tool chest to help your financial situations. I'd especially like to thank Carol and Crawford for their wisdom and for sharing their knowledge with us this evening. I really appreciate your expertise and your experience in helping our community. That was very informative. Thank you, guys.
Thank you.
The webinar is recorded, and as a reminder, you'll get a recording for that link tomorrow. But if you'd like to write to us or get in touch with Carol or Crawford, feel free to email me at kbergerson@ccalliance.org. On behalf of the entire colon cancer team, I'd like to thank everyone for attending tonight's webinar. I hope you found it informative and value-added. Have a good evening, and take care, everyone.